We sometimes joke that we have the worst business model in the world because we know that every day we're just going to give away care. But it's not about us. I mean, it's not about Neuroworx. It's about the people who come in here who need the therapy.
We opened with the whole premise of being able to give patients what they needed, not necessarily what could be billed for and what would be considered traditional outpatient physical therapy.
In 1999, I'd been practicing OB/GYN for 10 years in the south end of the Salt Lake Valley, and I had an accident on my backyard trampoline. Ended up with a spinal cord injury to my neck region, which left me completely paralyzed from the neck down. About 7 months after my accident, I was getting my therapy at home, and I happened to have an opportunity to meet Jan. And it was really a godsend for me because very early on I recognized this was a person who had the experience, the capability, and the intellect to help me progress.
Treating patients, and I think Dale being treated, we both realized that this patient population takes a lot more than a traditional outpatient physical therapy clinic can offer.
An Intermountain Healthcare Foundation grant allows us to carry out our mission, which is to provide the best opportunity for these people to rehabilitate to their highest possible level.
Most patients, if not all patients, are underfunded. So we decided very early on we were going to need some supplementary funding, and we also wanted to be able to give them longer treatment times, which insurance doesn't pay for. So we needed to be able to complement and supplement that extra half an hour, 45 minutes, or an hour. So I do bill for the first 45, and then the rest is supplemented by grant and foundation money.
Any little degree of increased function can make a quantum change in somebody's life. The ability to drive yourself, to transfer yourself from your wheelchair into your car, now to drive yourself to work, rather than depend on a ride, huge difference.
Part of the Intermountain Healthcare Foundation is that we actually set goals and outcomes. There's no one that stays just 45 minutes or an hour.
And that's another reason why the funding makes a big difference, is because people can come here and be here longer, they have more opportunity to interact, and they really help each other, which is it's actually much better than we ever anticipated it would be.
I always tell people I have the absolute perfect job. What we watch these people work towards makes coming to work every day wonderful.
It's been rewarding, and occasionally when somebody walks up and says, "Thanks for doing this," yeah, it's a nice paycheck.